My name is Adam Toms, and I had 3 transient ischemic attacks and a stroke at the age of 46. If I'd have been half an hour later, I would have been permanently paralysed on the left.
Have you ever felt a sudden numbness in your hand or a strange dizziness that came and went quickly? Chances are you brushed it off, telling yourself it was fatigue, stress, or maybe just dehydration. But what if your body was trying to whisper an urgent warning? Strokes rarely happen out of nowhere. In many cases, the body sends signals weeks or even a month before the event. The challenge is that most people ignore them, thinking they'll pass. Today, we will walk you through 10 subtle but critical signs your body may give you before a stroke. Number 1. Sudden, brief vision problems.
Imagine this, a Pasadena man goes to bed, he wakes up the next morning and he's lost half of the vision in one of his eyes. Now he's part of an international study to treat stroke of the eye, and doctors want patients to know that when it comes to this disorder, every minute counts.
Have you ever experienced a sudden moment when your vision shifts? Blurry shapes or double images begin to dance before your eyes? Or a sudden fog starts to cloud your sight? These aren't just fleeting annoyances. They are urgent signals from your brain. A silent alarm that a critical part might not be getting the oxygen it desperately needs. Let's take Peter, for example, a man from Pasadena who went to bed one night perfectly fine and woke up the next morning unable to see out of half of one eye. No pain, no warning. He did what most of us would do. He used some eye drops and went to work, not realizing he was in the middle of what doctors call a stroke of the eye. By the time specialists traced the cause, the blood flow to his optic nerve had already been interrupted.
It's an interruption of blood flow to the optic nerve. It's really usually sudden, painless vision loss. It happens most frequently when people notice it when they first wake up in the morning.
When blood flow is blocked or reduced, the brain's ability to function is compromised, and sometimes vision disturbances are the very first sign. That's why, if you or someone you know experiences sudden vision changes, immediate medical attention is crucial. Number 2. Unexpected numbness or weakness. Unexpected numbness or weakness in your arm, leg, or face that happens suddenly and lasts only a short time could be a sign of a transient ischemic attack, sometimes called a mini-stroke. A TIA happens because a small blood clot temporarily blocks blood flow in the brain. This blockage usually clears up quickly, so symptoms like numbness or weakness go away within minutes to hours without causing permanent damage. However, a TIA is a serious warning that a full stroke might happen soon if not treated. About 1 in 3 people who have a TIA will later have a stroke, often within the next year. This means even if the numbness or weakness disappears quickly, the brain has been affected and requires urgent medical attention to prevent further problems. Number 3. Trouble speaking or understanding words.
This is a scan of my brain after a stroke in 2019. That dark spot is the damage from the blood clot, and it produced what's called aphasia, the loss of ability to understand or express speech, which I will so adeptly portray for you now.
Intelligent, turn, blah, 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 blah. Fitazint, Herzoy, Rozoid.
When words suddenly slip away, when sentences tangle or understanding falters, it can feel like a momentary lapse. But neurologists warn it may be something far more serious, the brain's distress call before a stroke. This breakdown in speech or comprehension occurs when blood flow to the language centers in the left hemisphere is briefly cut off, often during a transient ischemic attack. A 2024 study found that people experiencing speech disturbances during a mini-stroke faced a sharply higher risk of a full stroke within months. The message is clear. When speech stumbles, act fast. Number 4. Dizziness and loss of balance.
In December of 2017, I woke up in the middle of the night and kind of felt sick, and I went to the kitchen to get some water, came back into my bedroom, and as I was walking back into the bedroom with a cup of water, suddenly I was on the ground, and my whole left leg was numb, like up to the waist, and the room was spinning really, really severely, and it was hard to see.
Meet Katie, a young woman who shared her story online, described waking up one night in 2017 feeling ill, only to collapse moments later as the room spun violently around her. She could barely see, and her right hand wouldn't obey her brain's commands. By the time paramedics arrived, the symptoms had faded, which is a classic pattern of a mini-stroke. Yet the episodes kept returning, each one unpredictable and terrifying.
So they obviously, they ruled out brain bleeding. They ruled out any dissection that they could find. I already had a dissection in my left internal carotid, but it wasn't really in the right spot in the brain in order to cause the type of stroke symptoms that I was having. From my understanding, if you're having that room spinning sensation and things that maybe affect both sides, that's pretty particular to a posterior circulation stroke, which affects the arteries going up through the brainstem.
Months of testing ruled out heart problems, migraines, and other causes, until doctors discovered signs of abnormal blood clotting, the likely culprit behind her recurring TIAS. Once she began preventive treatment with baby aspirin, the attacks stopped. Katie's story highlights how sudden dizziness, imbalance, or loss of coordination, even if brief, can signal a serious vascular event. The brain's posterior circulation, which controls balance and vision, is especially vulnerable. According to neurologists, these fleeting moments should never be ignored. They may be the brain's final warning before a full stroke. Number 5. Short, sharp headaches. Not every headache signals danger, but when pain strikes suddenly, sharp, intense, and unlike anything before, it can mark the beginning of a cerebral crisis. These thunderclap headaches, as neurologists call them, often occur when a blood vessel inside the brain ruptures, leading to a hemorrhagic stroke. A 2022 report found that nearly 40% of patients with subarachnoid hemorrhage described a sudden explosive headache just hours before collapse. It's the body's red alert, a surge of pressure as blood leaks into spaces never meant to hold it. If your head feels like it's about to burst, seek help immediately. Seconds matter when vessels give way. Number 6. Unexplained fatigue. We all feel tired at times, but fatigue that appears suddenly and without cause can be a neurological red flag. When parts of the brain are deprived of steady blood flow, they struggle to sustain even basic functions, and the body compensates by slowing down. Researchers noted that patients who experienced minor strokes often reported unusual exhaustion or mental fog days or weeks before the event. It's as if the brain, starved for oxygen, begins dimming its circuits one by one. This hidden fatigue, often mistaken for overwork or stress, can be the first whisper before the storm. 7. High blood pressure.
My name is Adam Toms, and I had 3 transient ischemic attacks and a stroke at the age of 46. It was high blood pressure that was the problem, undiagnosed high blood pressure. If I'd have been half an hour later, I would have been permanently paralysed on the left.
Adam Tomes was only 46 when he suddenly began speaking gibberish, a sign his brain was under attack. Quick action from his friend saved him from permanent paralysis. Doctors later found the cause: undiagnosed high blood pressure. Hypertension silently weakens and damages blood vessels, making them prone to rupture or blockage, the 2 main causes of stroke. Adam had no idea he was at risk. Like many, he thought stroke was only for the elderly. His story is a reminder that unchecked blood pressure can quietly build pressure in the brain until one critical moment changes everything. Number 8. Transient confusion or memory gaps. Ever walked into a room and suddenly forgotten why you're there? Not out of distraction, but out of disorientation? Brief episodes of confusion or memory loss can point to transient ischemic attacks. where the brain's blood supply is interrupted for just a few minutes. A 2021 study revealed that nearly 1 in 5 TIA patients experienced short-term memory or cognitive lapses before a major stroke. It's like a flicker in a light bulb moments before it burns out, the brain's circuits misfiring as oxygen falters. These moments may seem minor, but they're among the most telling clues that a larger attack could be near. Number 9. Nausea and vomiting with no clear reason. A sudden wave of nausea, especially when coupled with dizziness or imbalance, can be more than a stomach issue. It may indicate blood flow disruption to the brainstem or cerebellum, regions that control balance and autonomic functions. According to research, nearly 12% of posterior circulation strokes began with unexplained nausea or vomiting as the first symptom. The sensation arises because the brain's balance center, the vestibular nucleus, becomes confused by erratic blood supply. When the world spins and your stomach churns without cause, it's time to listen. Your brain might be in distress. Number 10. Tingling or pins and needles sensations.
Or if we have numbness or tingling in any part of the body, especially face or hands or legs, is typically where we're going to notice them. That could be a stroke.
That odd electric buzz or tingling in your face, arm, or leg may seem harmless, just a pinched nerve or bad posture. But in some cases, it's the nervous system misfiring under stress from reduced blood flow. A 2023 study highlighted that nearly 30% of ischemic stroke patients recalled experiencing brief episodes of numbness or tingling on one side of the body days before their stroke. These sensations occur because tiny vessels that feed sensory pathways are momentarily blocked, distorting nerve signals.
A lot of people are going to kind of stick their head in the sand. It's just human nature, especially with men, that we have this little thing, it only lasts a few seconds, and we'd rather not tell about it, because if we ignore it, then it's like it never happened. So I believe that these things are tremendously underreported, especially the small stuff that happens early on.
The thread that ties all these signs together is transient ischemic attacks, brief episodes of interrupted blood flow to the brain. So ask yourself, have you felt unexplained dizziness, sudden weakness, or strange vision changes recently? Did you brush them off as just being tired? Your body is wiser than you think. These signals aren't random. They're red flags waving weeks before a possible stroke. Listening to them could mean the difference between prevention and crisis.